Welcome to the Surgeons. I'm Dr. Wesley Hall.
I'm Dr. Scott Wrye. Thanks for tuning in. Today we're very excited to have a good friend of ours and a very good doctor in town, Dr. Matthew Mills. He's an ophthalmologist. He's going to talk to us about cataract surgery, cataracts, and lots of stuff about the eyeball.
We enjoy talking about it. I'm laughing because Dr. Wrye's saying that he looks into the wrong camera. Then I said I didn't look into the wrong camera. And then everybody on the set said the audience has no idea what we're talking about.
Right, but I was right in the end. And that's all that matters for the purpose of the viewing audience.
I want the viewing audience to know that we care about you looking into the right camera.
What I care about is Dr. Mills, who's coming in. Talk to us about cataracts.
He's not only coming in to talk about cataracts, we're going to get to have him do some cataract surgery. We're
right here on the couch?
Look at the cataract surgery, actual real surgery.
Right here on the couch?
Not on the couch. We're talking about doing that in an actual surgery center where we do surgery.
Sure, he's going to show us footage of an actual surgery, and then we're hopefully going to get to talk to one of his patients afterwards.
Well, at any rate, we're glad you joined us. Welcome to the show. Get ready for some surgery, and we'll see you here in just a minute.
Welcome back to the Surgeons. We're thrilled today, Dr. Hall and myself are thrilled to have a good friend of ours, Dr. Matthew Mills. He's here to talk to us about cataract surgery. Matt, I'm just going to turn it over to you. Tell us a little bit about yourself and your practice, and we'll go from there.
Well, I'm going to just say I'm not thrilled. I'm just marginally happy that Matt came in today.
I'm less than that, but we got to talk him up.
All right.
Okay. Well, gee whiz, guys. Hey, I'm happy to be here with you guys, regardless of whether or not that's reciprocated. But no, seriously, I have a lot of respect for these guys and what they do, and I'm happy to be involved in their show and for them to have invited me here today.
Well, so we wouldn't have you if we didn't. I mean, I know you suck when you're doing the Tough Mudder race with me. I'm just kidding you.
I'm not sure you ever made it.
I'm pretty sure we finished at the same time. At any rate, but we're here
because he was carrying you.
Oh, yeah, whatever it was.
Okay,
it was
you guys finished identical. Anyways,
but we're here to talk about your practice because we like you as an eye doc too, and we want to know more about stuff. I think one of the main things that you deal with is cataracts, right?
Absolutely. Yeah, day to day, that is probably the most common surgical condition that we address in our practice. And our practice is eye care professionals. And this practice has been in continuous operation in Northern Nevada for over 50 years. And I've sort of been at the helm of that for the last 15 years. And what we've done is we've sort of developed a position and sort of distinguished ourselves in this marketplace by striving to achieve the best outcomes and the most precise outcomes. And a lot of that has to do with the use and the introduction of advanced technology along the way. So I can say that we've been front runners in terms of a lot of innovative technologies and procedures in terms of cataract and refractive surgery.
What kind of technology? Because I know there are different kinds of lenses that gets used for these operations. What is the technology that you're using now?
This is a very exciting aspect of our field. And one of the things that drew me into ophthalmology to begin was the recognition that our technology is constantly evolving and constantly improving. So as recently as 2 to 3 months ago, I became the first surgeon in the state of Nevada to implant a new and improved multifocal lens implant. A multifocal lens implant is designed to allow a postoperative cataract patient to see at both distance and near.
So this has nothing to do if somebody's sober or not sober, multifocal, right? That's a different thing.
I think they work better when they're sober,
okay.
But not being sober is not a disqualifying
I just want to check.
Condition.
Matt, can you just back up just for a second? How does that work? Right, I mean, obviously, if you have bifocals, right, you've got one lens on the top, one lens on the bottom.
Right.
When you implant an implant, when you put an implant in, how do you make that work?
That's a great question. So, what a cataract is, first of all, is an opacification of the lens structure inside the eye, and of course, you guys know that. During surgery, we have to remove that and we have to replace that, and that's where we have different options, and we emphasize a lot of the premium IOLs. And the way that a refractive lens, a multifocal lens works is that the optics are, it's not analogous to a bifocal, which we're all familiar with. It's actually a device that has concentric rings etched into the surface, and this actually creates more than one focal point. And the way that it works is if an object is present at a near focal point, it will be in focus. And if there's no object there, it defaults to the next focal point.
Hey, Matt, can anybody get one of these? I mean, or is this only for specific people?
There are some inclusion criteria. People have to have a healthy macula and a healthy cornea.
How old are most of these patients usually?
You know, cataract surgery used to be something reserved for patients in their 70s.
Yeah.
Nowadays, because our success level is so high and our complication rates are so low, we've been able to lower that threshold, and we have patients coming in their 50s who are significantly impaired with their night driving activities or their golfing and those sorts of things. So really, anyone with a visually significant cataract, I would say anyone from the age of 50 on up.
Sure. Matt, I've got people telling me this. That means they're trying to get us to move along. So I'm going to ask you about some laser technology that you might use. You'd mentioned that earlier. I know you wanted to talk about that. Tell me more.
30 seconds, Dr. Mills. 30 seconds.
In 30 seconds.
Or less.
Approximately 3 years ago, I became the first surgeon in the state of Nevada to have a laser for cataract surgery. There's been a misconception out in the public community for 15 years that cataract surgery is performed with a laser, but that hasn't been the case until approximately 3 years ago when it was FDA approved. So I began using what's called the LensX laser for precision cataract surgery.
This was like 3 years ago, you said.
Right.
I think we're getting ready to actually go to the surgery center and watch some surgery here.
That's a true story.
Excellent.
And I'm excited about having
we're going to go do
come
that
over and watch us do that.
So let me ask you, are you going to use the laser and do a
Absolutely.
multifocal lens?
You know, those two technologies are used in conjunction most of the time. Not every multifocal patient is a candidate for laser, but the laser adds a layer of precision, especially in terms of astigmatism correction, that helps us achieve those very precise results that are needed for a successful multifocal patient.
Very good. Well, that's exciting stuff. We're going to go to surgery next. Thank you very much for coming in, Dr. Mills.
Thanks for having me.
My pleasure.
I am Dr. Matthew Mills, and I'm an ophthalmologist. I'm the CEO of Eye Care Professionals, and I specialize in advanced cataract and refractive surgery. We're here today to talk about advanced cataract surgery, including laser cataract surgery. So the first procedure that we videoed on our trip to the OR included sort of a traditional standard cataract procedure. In other words, not a laser procedure, but a traditional manual cataract surgery. So this is frequently done for patients who elect not to have the laser, or in some cases are not a candidate for the laser. And in this case, we prep the eye and instill some numbing drops. We have a little device that holds the eyelid open. And then at that point, I'll make a tiny incision with handheld instruments, and we inflate the eye with a substance that maintains a space, a working space inside the eye during the procedure. After that, we'll complete that temporal incision, and that's the main incision through which we accomplish our work. We are very meticulous in the way that we craft this incision because we are creating essentially a one-way valve that will be self-sealing and watertight at the conclusion of the case. So with the incision completed, then we go inside the eye, and I will manually create a circular incision in what's called the capsular bag, and that's a structure that houses the cataract at the outset of the procedure, and we utilize that same structure to contain and house the intraocular lens implant at the conclusion of the surgery. So I will create this circular incision in the capsule. Then I go in and break up the cataract into smaller pieces in what we call quadrants. Once we've been able to mobilize the lens and break it up into the quadrant, then we can proceed with removal. And the removal portion is essentially the same regardless of whether we're doing a manual technique or a laser surgery. So we go in with phacoemulsification. That's the name of the ultrasound instrument that both breaks up the lens and aspirates it. And then controlling the phacoemulsification with foot pedal and steering it around manually, I'm able to remove the opaque lens. And once we've removed the nucleus, which comprises the main body of the opaque lens, then we will go back with a smaller instrument that has simply the aspiration. We call that irrigation aspiration, or IA. So I'll go in with the IA handpiece and then remove the remnants of the peripheral part of the cataract that's called the cortex. So once we've cleaned up that capsular bag and removed all the cortex, we inflate the capsular bag with some viscoelastic, and then we inject the intraocular lens implant. At this point, the lens implant will unfold, and there are little arms on the lens implant called haptics, and these help stabilize and center that lens implant. And at this point, those will unfold and extend into the recesses of the capsular bag, which will help the lens implant to maintain good centration and position inside the eye. At that point, we just remove the viscoelastic from the capsular bag in the anterior chamber, and we are done. The entire procedure is painless for the most part. We do provide sedation for anesthesia through a patient's IV, and in addition, we use some topical numbing drops, and most of our patients really don't experience anything in the way of pain or discomfort, and in fact, some of them report back to me that as far as a procedure goes, it's probably the most enjoyable medical procedure they've ever had. So the advantages to using the LensX laser precision laser cataract surgery procedure as opposed to the traditional and standard procedure, those advantages, there are a number of advantages in this case. The primary advantage is that we are able to fine-tune a patient's astigmatism. In other words, we can use the laser to precisely place some incisions in the cornea, which can reduce a person's astigmatism, and this helps with the final visual outcome. And we are able to manually place these types of incisions, but the precision with which we can plan and position and locate these positions is just much greater with the laser. So in this case, we make a number of incisions with the laser. We can make our primary incision through which we do the bulk of our work. We can make the paracentesis incision. Another real advantage to the laser is the way that we make that capsulorhexis, or that circular incision in the capsular bag. All of us who are accomplished cataract surgeons are very adept at making this, and we attempt to create it in a certain size, certain diameter. We attempt to make it very centralized and circular, but none of us are a machine, and now we have a machine that can essentially punch out a perfectly round, perfectly centered, and complete 360-degree capsulorhexis incision. This is a safety improvement in that some of the complications that are encountered in cataract surgery, although they're rare, a lot of those arise during or related to the capsulorhexis. And since I became the first surgeon in Nevada to have this laser over 3 years ago, I have not seen one complication due to the laser capsulorhexis. The other advantages are that when we use the laser to pre-divide the nucleus. In other words, during a traditional surgery, I will divide the nucleus of the cataract into 4 quadrants, but I'm also, with the laser, able to apply some laser treatment into the lens itself, and this facilitates that maneuver, allowing us to divide a more dense cataract with less manual manipulation. This also can result in a lower amount of ultrasound energy being required to be applied inside the eye to remove the cataract. So again, that's a safety advantage of the laser procedure over the standard procedure. So to sort of summarize those advantages of the laser procedure, there's the precision in which we can create the capsulorhexis as well as the astigmatism correction. And then there are the safety advantages that come from a reproducible capsulorhexis incision and decreasing the amount of ultrasound or phacoemulsification energy that's required during the case. So there's some very real advantages to having the laser. Okay, now you've brought up the issue of how do we determine what power of replacement lens will work best for a patient. And this segues into another piece of technology that we have at our surgery center, and we've invested in and acquired for the benefit of our patients, and that's called the Aura. And the Aura uses advanced optical imaging as well as software, and this is known as wavefront technology. So essentially what happens is, in a standard surgery with traditional technology, we base that power selection of the lens implant on ultrasound measurements that are taken inside our office, and we also have optical measurements. But those are all based on an eye that still has the cataract intact and in place. Well, the Aura has come along, and this has really revolutionized the way that we approach the lens selection. What we are able to do with the Aura is we're able to take another measurement during the surgery after the cataract has been removed and before that new lens implant goes in. Well, that measurement with the lens already, the cataract already being removed, that's called an aphakic measurement. And between the wavefront technology and the aphakic status of the eye at that point, those things give us the most accurate method of predicting that lens implant power. And the reason that's important is because for most of our patients, we're targeting them for distance, and we want to achieve 20/20 or as close to it as we can. And this is the real differentiator in terms of distinguishing our outcomes. And we have a tremendous track record of achieving excellent vision, in many cases 20/20, and in some cases, in fact, superior 20/15.
Welcome back. We're back here on The Surgeons with Dr. Matt Mills. We've just lost Dr. Wrye. I don't know where he's gone to. Don't worry about it. We can carry on without him, I think, at least for the time being. But we've still got Dr. Mills here. We're glad to have it. And Dr. Mills has brought in Rose, who is a patient who has just had a cataract surgery a week ago, correct?
Correct.
And we were talking a little bit earlier about how this went for you. And so now I'm going to ask you to tell everybody, how'd this go for you?
Went real well. It was quite remarkable, the outcome of the surgery.
So Rose, you had told me, I had some difficulties with my vision.
Right.
I had had great vision all my life, but within the past several years, it started getting worse. You had seen your eye doctor, and he then referred you to Dr. Mills. You met with him, and you talked about what was needed. And Matt, you had said to Rose, hey, I think you got a cataract, right?
Absolutely. And cataracts are very common. It's actually a normal part of the aging process. And when Rose came to me, and I appreciate you being on the show with us and happy to have you here, she had some significant visual impairment, and she had some very definite opacification of her lens or cataract formation, and that blocks your view of the world.
So now, this was in both eyes,
in
correct?
both eyes, correct.
But you don't do both eyes at once, as we were talking about earlier. Usually you'll do one then the other. So you just did one this go round, is that right?
Right. We staged this over a 2-week period, and she had her first eye done last week. And when she came in for her 1-day post-op, she was already seeing 20/20 distance and almost 20/20 at near.
So Rose, when you had this done, this took about how long were you in getting this done?
The procedure itself was only like maybe 20 minutes.
And then you went home?
And I went home.
And how much pain did you have?
I had no pain at all.
So there's no pain.
No pain.
And you told me you could see
I could see
almost 100% better
on the way home.
on the way
On the
home.
way home.
I didn't
That's
I
remarkable.
didn't drive home, though my son did.
So then
That's good,
we're
'cause
a
we're
week
checking
later,
on that.
right? We're about a week out.
We're a week out.
And you were telling me that you had some bottles at home.
Right, I have little glass bottles on my dresser that have body oils in them.
Mm-hmm.
And I would look at them and they always would look the same. And the next morning when I got up and looked at those bottles, I realized that some of them were darker than the others.
Mm-hmm.
And before, I could not tell the difference
And
in the
having
shading
just
of the oils.
One eye,
And just one
all
eye.
of a sudden. Now I'm a little concerned because if you do the other eye,
I can see through walls.
I'm worried you're going to be like superhero powers.
We will have to report her to the authorities at that point, but it'll be okay. So
you
I
had
think
put
it's
in a
really
special
interesting.
lens, though, right?
We did use a special lens. We discussed all the options with Rose, and Rose was interested in a lens called the multifocal, and that's a special lens that patients can elect to have, and it actually corrects not only for distance but also for near. So when this is all said and done, and even right now she can function at both distance and near without correction, but when she has both eyes done and we have a good result in both eyes, it will probably just be a pair of sunglasses that you need going forward, and everything else you'll most likely be spectacle independent from, which also is remarkable.
And I think we had talked about this earlier, but when we say special lens, it's not like it makes the procedure any more difficult. It's still a relatively simple, safe thing with the multifocal lens as well, right?
You know, when we take out a cataract, we 100% of the time are going to put in a lens. And the difference becomes what type of lens do we put in. Sometimes we'll put in a sort of a traditional standard lens for distance. We may put in an astigmatic correcting lens, which would also be for distance in people with astigmatism. And then in Rose's case, we elected even a more advanced lens for distance and near, and we actually were able to achieve the astigmatism correction using the laser, the LensX laser that we had
And this
talked
was done
about
at the same time?
preoperatively. Yes, that's all part of the same procedure.
Well, I tell you what, one thing I know is you got a great surgeon that's taking care of you. I'm really glad you're seeing very well. It's really, really great to have you on the show. It's really great to have you on the show. We're happy to educate the people about these different kinds of options that are available for situations like yours. So thank you very much for coming.
You're welcome.
Thank you.
Awesome. Thanks so much.
All right.
Thanks for coming.